The endometriosis is responsible for 25 to 50% in the infertile woman. Its prevalence is 25 to 50%. And the major cause of pelvic pain and infertility is because of the endometriosis. Uh, if you do a laparoscopy, in approximately 48% of the patient, when you are not suspected endometriosis, you find endometriosis. Classification, I need not go into the detail. Normally, we, for understanding, we say it is a mild endometriosis or severe endometriosis. And the classification is and deep pelvic endometriosis with the involvement of the ureter and bowel. It is very important to note that it is a coexistence of adenomyosis, which is making a life uh, of infertile couple miserable because there is a 90% prevalence rate of adenomyosis in those patients with established pelvic endometriosis, and which is the culprit for reduction in the implantation rate. Uh, and this associates the infertility. It is interesting to note that before, when you examine the patient, infertile couple, and you suspected endometriosis, before doing any investigation, by just examining the patient, at least you should have some idea whether you are dealing with a deep pelvic endometriosis or you are dealing with the mild endometriosis. So you see, the dysmenorrhea is very common, but dyspareunia, chronic pelvic pain, tenderness, adnexal mass, and restricted mobility is more in severe endometriosis, deep pelvic endometriosis, and endometrioma. So if such findings are not there, probably you are dealing with the milder form of endometriosis. So basically, it's a trio of it is not seen here, the oxidative stress, the hyperestrogenic level, and chronic inflammation. It's a trio of these three, which makes give rise to the endometriosis, and which are the key factor which is responsible for the genetic alteration in the oocyte quality. This already has been dealt. What are the mechanism endometriosis? The oxidative stress is one of the important factor which is responsible and which is creating a problem in the intracellular metabolism and mitochondrial function and spindle and other things. One more evidence that endometriosis causes a lot of apoptosis, and which is true with the endometrioma also. And apoptosis, chances of apoptosis of the neural cells increases as the endometriosis grade increases. What are those abnormalities which happens in the oocyte? The detrimental effect in the normal physiology of the granulosa cells reduces the steroidogenesis and granulosa cells. Folliculogenesis is altered. With increased intracellular ROS, lower mitochondrial content, reduces the oocyte quality. Hello, hello, sorry. F. Okay, fine. Yeah. एक minute, I just stop sharing. Why it is good? But then it is already started from the beginning. Okay, fine, fine, fine. Okay. So there are some more evidence. Uh, what happens actually to the oocyte? So if you look at the oocyte, there is more of a central granulation tissue. The cytoplasm is dark. It affects the zona pellucida. Zona pellucida may be large, dark, different, and it may be a thin zona pellucida. It affects the polar body also. Polar body can be flat, fragmented, or irregular. So this gives idea about the effect of endometriosis on the oocyte quality. This is one more study which, which shows that because of the dysregulation of the steroidogenesis, it affects the oocyte maturation. These are the various mechanism and various routes how it affects the oocyte quality. What about the genetic constitution of the oocyte? We have understood that endometriosis affects the oocyte quality, but what about the genetic constitution? There is some evidence that the most prominent incidence of differential expression of the genes was found between oocyte from ovarian endometriosis compared to the oocyte from healthy donors. But very important to note, and this must be registered in your mind, that endometriosis has a global effect in oocyte quality independently if the endometrioma is present or not in the ovary. What is the meaning? Not necessarily ovarian endometrioma affects the oocyte quality. Even if it is a mild endometriosis, even if it is a severe endometriosis, it definitely affects the oocyte quality. And this has to be understood clearly. Now, what is its effect on AMH? Because of the endometriosis, there is a low level compared to a tubal factor, and there is faster decline in AMH. You can see from the graph that there is a faster decline and there is a low level of AMH. And you must remember this. This is independent of severity or invasiveness of disease. That means it is not necessary that if it is a severe pelvic endometriosis, the AMH level will be too less as compared to the milder endometriosis. No, it is independent of invasiveness and the severity of the disease. And low levels are more marked with the endometrioma. So, what is the mechanism put forward for this? It's a chronic inflammation and altered immunomodulation, which leads to follicular damage and dysfunction. Is a laparoscopy must to diagnose endometriosis, especially with the milder endometriosis? It is justifiable in young couple with marriage life less than 5 years, no or correctable coexist with other factors of infertility, and the patient is willing to wait before going for IVF. So it's justifiable in younger couple. When laparoscopy is performed, for other reason, which has been discussed well before, among the every 8 patients undergoing laparoscopic surgery for minimal to mild endometriosis, it is definitely effective, but it rate in only 1 in 8 patients. Sometimes the question asks, what is more effective, GnRH or surgery in mild endometriosis? Both are effective. GnRH and surgery both have OR 7.68 and 1.63. The pregnancy in the range of 55 to 65% with either. So both are effective. This is very important slide. What is the effect of pregnancy? What is the effect of surgery on the spontaneous pregnancy? So you can look at this slide, and after the surgical procedure, the pregnancy rate start increasing after 1 month, and gradually it increases, and the maximum it reaches at 12 months post-operatively, and following that there is a plateau. So after good corrective surgery, it is a good idea to wait for 1 year in younger patient if there is no other coexistent factors are there for spontaneous pregnancy to occur. Now, what is the effect of surgery in endometriosis? Effectiveness. Because the effectiveness of the surgery in endometriosis is highly skill dependent. If the surgeon has done incomplete job, it is as useless as you understand.